Hello, everyone. This is Dawn from the sixth group, and you're listening to the TikTalks podcast, where we tackle one of the most serious threats to global public health, the alarming emergence of antimicrobial resistance. Due to the excessive use of these drugs, antimicrobial resistance has been known to be spreading not only in the field of human medicine, but also in food producing animals and agriculture. This abuse or misuse of antimicrobial drugs encourages microbes to multiply with drug-resistant genes, making it harder for once known effective treatments to be used against them. Why does this pose a problem in today's world? Well, we can't just prescribe higher doses or wait for new antibiotics for an alternative. In fact, the number of new approved drugs during the past 30 years seems to be declining, with only three new antibiotics receiving approval during those 30 years. One solution to this problem is to gradually spread information about antimicrobial resistance, and we are here today to achieve exactly that. We'll discuss everything there is to know, starting from what the wicked problem is, why is it a wicked problem, and how post-normal science can use an approach in its policy making and evaluation.
We have Miss Kwai to explain to us what is AMR or antimicrobial resistance.
The wicked problem that our group identified is the rising trend of antimicrobial resistance in the whole world, in which the World Health Organization flagged antimicrobial resistance as one of the top 10 global public health concerns. But first, we need to define what does antimicrobial resistance means. Generally, antimicrobial resistance, also known as AMR, occurs when microbes such as bacteria, fungi, viruses, and parasites no longer respond to antimicrobial medicines that are designed to kill them. This means that infections brought by these microbes are harder to treat, or sometimes they are impossible to treat at all. As a consequence of the drug resistance, antimicrobial resistant infections require extended hospital stays, additional follow-up doctor visits, and costly and toxic alternatives. Centers for Disease Control and Prevention 2020. Inherently, antimicrobial resistance occurs because microorganisms change as a result to exposure to antimicrobial medicines. However, the overuse of these antimicrobial drugs makes resistant microbes more common. Hence, the more we use antimicrobial medicines, the more chances the microorganisms have become resistant to them. For instance, Barber 2016 revealed that the prevalent self-medication with antibiotics in the Philippines is cited as the major contributor as to why many Filipinos are resistant to antibiotics. Hence, the Department of Health warned the general public against antibiotic resistance after UK health authorities flagged a surge in antibiotic resistance infections in the Philippines during the pandemic.
Now, the listeners may wonder, how can taking antibiotics contribute to antibiotic resistance? How does antibiotic resistance even happen? What is the single most significant factor driving increasing rates of antibiotic resistance? And why is it important to take antibiotics exactly as prescribed? Let us continue listening in so that we may have these questions answered by my fellow TikTokers as they share factual knowledge concerning this global health problem.
I can still clearly remember when I was younger that I used to believe that antibiotics are basically the answer for any illness. Antibiotics are widely accessible in our neighborhood that even in small sari-sari stores, they have available amoxicillin. Hence, it was not difficult for us and any ordinary Filipinos to procure it whenever we want. If I am not mistaken, my caregivers constantly asked me to buy antibiotics in the Changi to the point that the first medicine that I have memorized both in spelling and pronunciation is the word amoxicillin. However, as I grew up, more and more advocacies against antimicrobial resistance, especially antibiotic resistance in the Philippines, opened my eyes to the misuse and misconceptions of such medicines that results to adverse effects on the health of the community.
I have eczema. My flare ups usually occur on my feet. One time, my rash got infected and I had a high fever. My mother was so worried that she handed me a pill. It was an antibiotic that she was prescribed for her ear infection, but was not able to use since she was still under treatment for her ulcer. I had to explain to her that not all antibiotics are the same. There are different kinds and each target only specific types of infection. I told her that if I take the pill, my fever might still not subside as the antibiotic may not work for my skin infection. It would also lead to being resistant to that antibiotic, which would make future infections harder to treat.
Allow me to take you down memory lane. As an inquisitive young man, I came upon a pamphlet about immunosuppressants and how their mechanism impacts our immune systems. My mom, who's a doctor and the hospital's chief, decided to take me to witness one of her patients as she diagnoses the patient's sickness. It was later discovered that the patient had misused the immunosuppressant prednisone, corticosteroid, without professional medical advice. Thus, the patient developed drug resistance to the said medication. I've only used prednisone once, under the advice and supervision of my dermatologist. The continual overuse and abuse of OTC, over-the-counter, drugs and powerful immunosuppressants pose a significant concern since microbes continue to develop in ways that render these medications ineffective.
You may be wondering, why is this a wicked problem? The idea of wicked problems, which originated in a study by Rettel and Weber on planning theory, depicts certain policy issues as difficult obstacles that do not respond to traditional problem-solving procedures. Therefore, wicked problems are defined by the fact that offered solutions cannot be regarded as right or wrong, but rather as more or less acceptable, and therefore do not allow for a trial and error approach to policy making. Instead, wicked challenges, according to them, provide policymakers just one chance to solve the problem. If that fails, the failed policy will have altered the original problem to the point that the original solutions are no longer viable. If super wicked problems are not to become unsolvable policy dilemmas, they demand severe and immediate solutions. In the case of antimicrobial resistance, it is clear that increased drug resistance would aggravate the current problem, prompting fears of a post-antibiotic period. In short, there is a discernible trend toward increasingly complicated AMR cases that are either difficult to treat or do not react to medicines at all. Indeed, resistance to all popular therapies has already been seen in severe illnesses such as TB and gonorrhea. With the increasing prevalence of multi and extensively drug resistant diseases, as well as a lack of new antibiotics under development, the danger of complete antimicrobial resistance is no longer an abstract worst case scenario. This does not only indicate the need to make hasty decisions in the face of a large and serious risk of harm to individuals and populations, but also considers the ethics of acting in the face of necessity, urgency, and uncertainty, and how this may differ from policy responses made in normal circumstances. Now we have Mr. John to tell us how post-normal science approach can be applied in its policymaking and evaluation.
We have to remember that the concept of post-normal science was conceived from the changing conditions of science, especially in its social context. Hence, the goal of this movement is to innovatively solve the wicked problems that we have in the modern times with the help of our respective stakeholders. In this regard, we have to focus on the relationship of science and society before we introduce them into policies, providing a somewhat extended peer community that may eventually lead to the democratization of science. On the contrary, antimicrobial resistance or AMR continues to be a major challenge to global health. As such, if we are not able to take action to this, it can eventually become the leading cause of death with 10 million victims per year by 2050. Hence, the organization that I belong to, which is composed of different specialists in the field, present the following perspectives to solve this problem. especially in the post-normal scientific world. The first step is to launch a worldwide public awareness campaign. Above all else, we must educate our society on the dangers of antibiotic abuse and misuse, since globally, patients continue to seek them from doctors or purchase them over the counter. In the long run, an effective and well delivered public campaign might cut the number of antibiotic prescriptions by 36%. Second, improve global drug resistance and microbial consumption surveillance. We must not only educate people about the hazards of this practice, but we must also monitor existing cases in order to forecast future threats and to understand the mechanics of acquiring new resistance. As a result, we need to better structure antibiotic use in humans and animals, explore drug resistance rates, and learn more about the molecular foundations of AMR. We can also encourage the development and use of vaccines as an alternative. The number of infected persons who require antibiotic treatment would decrease as vaccination rates increases. Although no licensed vaccines against the most urgent infections are currently available, potential trial candidates are on the horizon. It is, however, recommended that more money be put into the early stage research for the creation of novel vaccinations. Finally, we must form a worldwide coalition to take effective action. After all, to make substantial progress against AMR, global action is required. It is critical to place AMR on the worldwide political agenda and to address it using the relevant principles in order to institute change. Engaging with the United Nations, for example, might facilitate this.
So, now that we've heard about the hows and the whys of the wicked problem, what matters now is how we use this information in order to address the antimicrobial resistance problem in our own little ways. Now that we've also heard the various narratives of my fellow TikTokers, it is time to reflect about our own actions that might have contributed to the wicked problem, whether it was intentional or not. Let me end this podcast by saying a quote by Johann Wolfgang von Goethe: knowing is not enough. We must apply. Willing is not enough. We must do. Have a nice day, everyone, and thank you for tuning in to the TikToks podcast.